All right, so you were just diagnosed with cancer, and finding the right treatment for cancer, it can be difficult because there are so many options out there, but there is a treatment center right here in the Valley where patients, they are discovering and getting renewed hope. This is Dr. John Kressel of Phoenix CyberKnife, and he's here with all the details. Great to have you here.
Thanks.
Again, you have the C word, the cancer word, and you get frightened, you don't know where to begin. Hopefully you start your own research and you become an advocate. What is CyberKnife? Because it's not widely known in a lot of instances.
So CyberKnife is a form of radiation therapy, which is one of the main treatment modalities for cancer, surgery, chemotherapy, and radiation. And CyberKnife is just one of the more advanced forms of radiation therapy, very pinpoint, very accurate, and in many cases can eliminate or reduce side effects.
Yes, that pinpoint precision that you often talk about. Talk about the treatment itself. We're going to look inside the treatment facility, state of the art.
So it's an outpatient, so there's no needles, there's no anesthesia. A lot of patients come in, get their treatment, and then carry on with their normal activities throughout the day. For example, yesterday we had some individuals who were treated for brain as well as for prostate, and got their treatments, and one went golfing later that day and the other one went back to work.
How is that? How are they able to do that versus some of the other types of treatments where they're sick and the side effects are very intense? What makes CyberKnife so different?
Well, it's just really the principle of treating the target that you want to, or the tumor, and then sparing or preventing radiation from treating a lot of the healthy tissues or organs that a lot of times is responsible for the side effects.
And what type of cancers can you treat?
Well, with CyberKnife, it's basically any type of cancer. So, brain, head and neck, lung, prostate, pancreas, liver, breast. So, it's all of the main, cancers that we can treat.
So when someone comes to you, they could be at a number of stages, stage 1, possibly stage 4. What if someone's not a good candidate for CyberKnife?
Well, that's the other nice thing about our center, is it's one of the only centers that really offers the whole spectrum of forms of radiation therapy. So we don't have to just pick or choose of what's available to offer to our patients. Mm-hmm. We can actually, provide them whatever's best type of treatment for their particular case, whether it's CyberKnife or more standard types of radiation therapy, still utilizing the precision and accuracy that we have.
And you offer all that right there at CyberKnife.
All in one spot.
Right, so it could not, I'm glad you said that, because we do have a patient coming up, Harold, in a little while. It wasn't appropriate for him, but he could still go to CyberKnife and get treatment.
That's true. We sat down and chatted with him and gave him all of his options, and really that's the main message, as you said, to be your own advocate, is find out what all of your options are before you choose. Mm-hmm. And many times you need to really, find out if, the center or the physicians that you're dealing with can actually offer you all of the options. They may not, and they may not be telling you that.
Absolutely. And what about side effects?
So again, it depends on the site that we're treating, but it's just the general idea that if you're minimizing the radiation dose to healthy tissues, the side effects in many instances are much less or absent.
And it's a very short treatment in a lot of cases for a lot of these patients, right?
Yeah, the biggest example is comparing for prostate cancer, standard 45 fractions, which we'll visit with our patient today, over 9 weeks, versus 5 days, where the treatment is done in a week.
And what about insurance?
It's covered by Medicare and all of the major carriers.
Right, so that should never be an option when thinking about treatment and care.
Nope.
All right, so Dr. Kressel is going to join us in a moment with his patient. You'll hear more about CyberKnife. But if you have any questions for Phoenix CyberKnife Radiation Oncology Center, we encourage you to write those questions down and email them to info@pcroc.com. They are located at 4611 East Shea Boulevard, that is in Phoenix. If you'd like to book an appointment, please call 602-441-3845, or you can visit them online, phoenixcyberknifecenter.com.